today we know every day there may be a virus emerging. The H7 coming from China, you have MERS corona coming from Middle East, and very recently, in the last week only, 6 or 7 days before, early H6N1, a human case was reported from Taiwan. Even though we knew that H6N1 was circulating in poultry, but it has already jumped. So similarly, many other viruses are going to jump from, so that's one of the major theme of today's my talk. Towards the end of it, we will tell you that what we are trying to convey to everyone. See, the emerging, especially the emerging respiratory viruses, can take a country to a hostage. You can see the picture of a Hong Kong airport at the time of SARS. Hong Kong is one of the very busy airports, but nobody is there. So the enormous economic impact it can bring, especially when it is respiratory. When it is bloodborne, you have various reasons. It doesn't spread like that. Respiratory, it's very difficult to contain the disease. If you look at the 10 leading causes of death in the world, the 2011 report, WHO report, says respiratory viruses is killing around 3.2 million people. So this definitely is an underestimate. The real figures must be much more, so we know. And when it comes to poor countries or low socioeconomic strata, you will find the respiratory infections or lower respiratory infections going as the #1 killer. So it is acute respiratory viral infections are a really leading cause of death, and especially in children, 18% of mortality. It's a very huge number when you turn it into the real figures. The very young people are more susceptible. You have a huge number of immunocompromised patients are now coming up because of the treatment or because of the new diseases like HIV/AIDS, and the elderly population. Our population also, at least in some of the developed areas, the population has slowly started aging. You have the longevity is increasing, so that group is again susceptible. So all these people are, the young as well as old and immunocompromised, are more susceptible to respiratory or most of these viral.